Video, we will learn about the types of dressings. So following wound debridement and cleaning, a suitable dressing is applied to the wound and changed appropriately to maintain an optimal healing environment. In addition, wounds must be continually monitored as their characteristics and dressing requirements change over time. So what is the primary function of a dressing? The primary function of the dressing is to maintain a moist but not excessively moist environment and protect the wound. Now we will look at the selection and frequency of dressing changes. So a dressing should keep the wound moist enough to promote healing, but excess exudate must be absorbed away from the wound to prevent damage of the healthy tissue. Some dressings may impede some aspects of wound healing. They should be used with caution. As an example, alginate dressing. Alginate dressings have high calcium content, so they may impede epithelialization. And some of the dressings have high silver content and they are potentially cytotoxic and should not be used in the absence of significant infection. So we can say hydrogels can be used for the debridement stage, low adherent dressings that maintain moisture balance for the granulation stage, and low adherent dressings for the epithelialization stage. So how often dressing needs to be changed? Dressing needs to be changed once in a day or every other day to avoid disturbing the wound healing environment. So how often we have to change the dressing and what type of dressing should be used will depend upon the degree of drainage or moisture of the wound. For example, some wounds like venous ulcers will require more common dressing changes as they have more exudates or more secretions coming out of the wound surface. Now coming to the types of common dressings. The common dressings can be classified as open, semi-open and semi-occlusive. Open dressings are usually gauze and that is used along with the saline. It is usually moistened with the saline and gauze is used for packing also, but gauze is relatively inexpensive but it has to be changed more frequently. Then comes semi-open dressings. Semi-open dressings generally do not maintain a moisture-rich environment or provide good exudate control. They are only used in special circumstances. For example, in postoperative wounds, zero form over the burn wound harvest area. Then comes semi-occlusive dressings. Semi-occlusive dressings are commonly used for chronic wounds and they have different properties and absorptive capacities and bacteriostatic activity. Some of the examples of semi-occlusive dressings are films, foams, alginates, hydrocolloids and hydrogels. So we will see one by one in the next slides. First one is film. So films are polymer films. They are transparent sheets of synthetic dressing. They are self-adhesive and they are permeable to water vapor and oxygen. And they are impermeable to large molecules like proteins and bacteria. So they trap wound fluid enzymes. Wound fluid enzymes are beneficial for wound healing. So these film dressings trap wound fluid enzymes within the dressing and prevents bacterial invasion. So what are some of the disadvantages? The disadvantages include less absorptive capacity. They have less absorptive capacity and if the wound dries out, the film dressings may adhere to the wound and while removing it may be painful for the patient and it may damage the epithelialization which might have already happened. Then coming to foams. So what are foams? Foam dressings can be thought of as film dressings with the addition of absorbency. So they have more absorptive capacity than film dressings They consist of two layers, hydrophilic layer which is adjacent to the wound surface, and there is an hydrophobic layer which is on the opposite side. So this hydrophilic layer will help in absorbing the excess fluid and drainage, whereas the hydrophobic layer will prevent leakage and bacterial contamination. So they have high absorptive capacity and can be used to pack cavities. So what are some of the disadvantages? They are opaque. Foam dressings are opaque and they may need to be changed each day, and some foam dressings may not be appropriate on minimally exudative wounds as they may cause desiccation. So what is desiccation? A wound desiccation is the drying out of the wound which impedes healing by killing cells and forming a scab. So for this reason, foam dressings may not be appropriate on minimally exudative wounds. Next come alginates. Alginates are natural complex polysaccharides from various types of algae. They form the basis for alginate dressings. They are insoluble in water. Alginates are insoluble in water and they exchange calcium ions with the sodium ions in the wound fluid, and they form a gel that covers the wound. So alginates come in various forms including ribbons, beads and pads, and they are more appropriate for moderately to heavily exudative wounds. So what are some of the advantages? The advantages of alginate wounds include they augment hemostasis. Alginate augment hemostasis and they can be used for wound packing, and most can be washed away with just normal saline, and there will be minimal pain for the patient. These alginate dressings can be left in place for several days. So what are some of the disadvantages? The alginate dressings require a secondary dressing that must be removed to monitor the wound, and they can be too drying on a minimally exudative wound, and they have an unpleasant odor or a different smell. Then coming to hydrocolloids. So what are hydrocolloids? Hydrocolloids usually consist of a gel or a foam on a carrier of self-adhesive polyurethane film. The colloid composition of this dressing traps exudate and creates a moist environment. So the advantages are that the bacteria and debris are trapped and washed away with dressing changes in a gentle, painless form of mechanical debridement. Then again, there is another advantage that the hydrocolloids is the ability to use them for packing wounds. So what are some of the disadvantages? The disadvantages include it might have a bad smell, potential need for daily dressing changes, and the possibility for allergic contact dermatitis. So these are some of the disadvantages of hydrocolloids. Now coming to hydrogels. Hydrogels are a matrix of various types of synthetic polymers that are usually sandwiched between two sheets of removable film. There is an inner layer which is placed against the wound and an outer layer that can be removed to make the dressing permeable to fluid. So hydrogels are usually used for dry wounds, and they initially lower the temperature of the wound environment they cover. So because of this, some of the patients may feel a cooling pain relief. And hydrogels have been found to selectively permit gram-negative bacteria to proliferate, which is the disadvantage of the hydrogel. Then coming to hydroactive. Hydroactive is a polyurethane matrix that combines the properties of a gel and a foam. So it's a gel plus foam. And hydroactive selectively absorbs excess water or drainage while leaving the good growth factors and other proteins behind. So in today's video, we have seen different types of wound dressings, open, semi-open and semi-occlusive, and also the different types of semi-occlusive dressings, their advantages and disadvantages. Thank you for watching. Please like and subscribe.